Hi everybody. It's actually taken me several times to record this video because my thoughts about COVID-19 are still evolving. That's the honest truth. There's so much happening every day. There's so much news every day. There's so much to digest and analyze and understand. And I don't have it all figured out yet. I don't have it figured out what's going on right now. And I definitely don't have it figured out what's going to happen in the future. It all feels very uncertain and unknown. I don't know what community behavioral health is going to look like in the future, if the changes that we're making to adapt to this crisis are going to become permanent. I suspect some of them will. Like, we may recognize that some of the work we were doing face-to-face in person could be done remotely. And I'm not sure that's a bad thing. But as you've probably heard me talk about before, I'm really passionate about the level of connection that can happen when services are provided in the community in kind of a wraparound approach. And right now, we can't do as much of that. I think some agencies are still doing some of that and trying to be really safe and careful. And some agencies are using protective equipment to make that work. And other folks are just, doing it. And some folks are just not doing it. So there's all different kinds of approaches right now. And I think the thing I wanted to say about it is when I talked before about the importance of community behavioral health and the value of those face-to-face services, what I was really talking about was the value of connection. And I do think it's possible to maintain and maybe even to build connection when you're not face-to-face with someone. That the level of engagement that you have with a person is not just based on being in the same room with them. And I think about that in terms of when I'm talking to you all, because I'm not in the same room as any of you. But I do feel like often we have a conversation, or I have a conversation with someone from across the country about topics that come up on LinkedIn or in other forums. And that's a real connection. I feel like I have friends that I've never met in person, and they feel like genuine friends to me. Definitely genuine colleagues, definitely acquaintances, people from all over the country. And that's kind of the beauty of technology. And not everyone has access to that level of technology. So that is true and means that some people are being left behind when we're moving everything to telemedicine. But I just want to say that when I talked about the value of community behavioral health, maybe some of that magic that happens isn't just based on being in person with someone. It's based on how fully you kind of connect with that person and how much you get involved in what's going on with them. So if a person is struggling with a serious mental illness and you ask about their life and not just their symptoms, I think that's a level of engagement and connection. If you're talking to a family and you ask about what's going on for them with their house, with their pets, with their extended family, that's a level of connection. And I think maybe when we think about connection and whether we're doing something in person in the community, which is one way to kind of get maybe even sometimes a shortcut to that connection, because when you're face-to-face with someone, you can just build a stronger tie to them sometimes, I think. But that doesn't mean that's the only way to build a connection. And I don't think that means that just because right now we're moving to telemedicine, the community behavioral health providers don't still have this huge level of value that's important to the healthcare system. So no matter how long this virus lasts, which feels unknown, I think at the end of it, whatever reality we're living in, the principles of community behavioral health are still going to apply. They apply now throughout this crisis, and they're going to be important in the future. So that's why I'm still passionate about the work that I do to try to help community behavioral health providers improve services, expand access, all of the things that I've been passionate about all along. And I just thought I would share that with you in case it helps you feel a little bit reconnected to that sense of what we're doing too. So I hope you guys are all well. I'm thinking of you, sending you good thoughts, and let me know what you think about that.